Gentleman from Kentucky, Mr. Massey.
Thank you, Mr. Chairman. Mr. Lumpkin and Major General LaRiviere, as you already know, there are members of Kentucky's Air National Guard in country, and so I hope you'll understand that my first questions will be focused on their safety and training and well-being. But I need to ask Dr. Lurie a question first. Are you familiar with the treatment of the 3 patients in the United States, the treatment regimen that they've received? We heard in the press that they received ZMapp and also perhaps blood transfusions. Is that true?
So there are more than 3 patients treated in the United States, but I have some familiarity with their treatment, yes.
Right. So does it include blood transfusions and ZMapp?
So my understanding is that some patients, certainly early on, received ZMapp when it was available, and some of the patients have received blood transfusions.
So the best minds that we have, the best doctors that we have in this country, their consensus was that that would be the best treatment for them. Major General, my question to you is, can you assure us that the best treatment available in this country will be available to our soldiers in the unfortunate circumstance that any of them contracts Ebola?
Yes, sir, absolutely. As I stated earlier, there'll be a Role 2 hospital both in Monrovia and in Senegal where your Kentucky National Guardsmen will be stationed that's there to exclusively take care of U.S. military personnel.
And when they return stateside, will they have access to ZMapp and blood transfusions if that's what the doctors prescribe?
Whatever the doctors prescribe, it'll be available for them.
Okay, thank you very much. Mr. Torbay, you seem to be sort of where the common sense resides here because you've been on the front fighting Ebola, and I really appreciate what you've done over there. And clearly our futures are linked with West Africa. We want to see it solved. We want to see it cured over there. And some of the things that you've mentioned today about gradiating people into no risk, low risk, and high risk, and then treating them differently instead of a one-size-fits-all makes a lot of sense to me. My question to you is it possible, not likely, but is it possible to contract Ebola by sitting next to somebody who's exhibiting symptoms on a bus?
Thank you for your question. First of all, for the record, I'm not a doctor, so I cannot be very specific when it comes to that. But from what we learned is unless there's contact with bodily fluid.
Would that include perspiration?
That could include perspiration.
And do you have to contact the skin, or could you touch somewhere that an Ebola victim has touched?
I can't answer that. My understanding is it has to be through a broken skin, but I'm not really sure about that.
So to your protocols, but would you say it's possible, even if it's not likely? Your protocols that you described before say that somebody who has a classification of low risk is prevented from taking public transportation. So surely you foresee that somebody, it's maybe not likely, but is it possible that somebody could catch Ebola on a bus?
We haven't experienced that. You know, with Ebola, it could be possible. There's no scientific evidence that proves it or proves against it.
There's no scientific evidence that it can be transmitted through saliva, vomit, perspiration?
Saliva, vomit, perspiration, yes.
Okay. Does it live on surfaces? Can it live for more than 15 minutes on a surface?
I cannot answer that.
You can't answer that?
I do not know the answer to that.
Well, maybe Dr. Lurie can. Can Ebola survive outside of a patient on an inert surface for any period of time?
It can survive on an inert surface for variable periods of time, depending on the temperature.
Then let me
and
ask you, is it possible? I'm not asking you, is it likely? Is it possible that somebody could contract Ebola sitting on a bus next to somebody who has it? Can you imagine a way that could happen? Is it possible?
One would have to have been in contact with the body fluids of that person.
Does that include perspiration?
It does include perspiration.
Okay. Major General, I want to get back to our soldiers here. You've assured us that they've been adequately trained in avoiding the contraction of Ebola. If a soldier came to you, General, is it possible, not likely, is it possible to contract Ebola sitting next to somebody on a bus who has it? What would your answer be to them? And I trust you're going to give us a straight answer.
So I would defer to the medical professionals, as the doctor just said. It can be transmitted through sweat, bodily fluids has been noted, and I would say that that is why we have the 3 feet separation. That's why we don't.
So if I'm a soldier and I asked you that, sir, what would your answer be?
Well, I guess my answer would be it's a hypothetical.
It could certainly happen.
It could possibly happen.
I'm asking you to answer a hypothetical. Then
I am. You are asking me to answer
okay.
a hypothetical. So it could possibly happen, but I would defer and say low likelihood, and you need to follow the procedures that you were taught in your training session.
I'm hoping they're getting the best training possible, and I'm concerned if they're being told they can't catch it on a bus. Can you tell me what your answer to the soldier would be if he said, "Sir, can I contract?"
Well, for the record, they're not getting on buses with Liberian citizens, and your Kentucky Guardsmen are actually in Senegal. So,
understood. We have other members from Kentucky serving in the military that are going to be in, I understand it, hot zones.
And Fort Campbell folks will be there, obviously.
Right.
But they won't be getting on buses with Liberian personnel either, and so they will. I would tell them to go ahead and follow their protocols.
So just quickly, our confidence has been shaken in the CDC because we get conflicting answers. Right. And when I first heard the military was going overseas to combat Ebola, I was skeptical. But then on second thought, I said that's where our competency in the government resides, where the confidence resides in the American public is with our military ability to focus on a mission. Today, you've answered some questions where you deferred to CDC guidance. For instance, whether they should be quarantined for 10 days in country or 21 days in country. What I'm asking you, for the safety of the soldiers and for the safety of the public, is to use your own judgment. We trust the military, actually, more than the CDC on this. So please use that to guide you.
No, absolutely, and that's why I'd reiterate that once they return, we are having not the self-monitoring, but we're actually exceeding CDC standards because we're the military of having those individuals monitored by their units once they're back.
And the public, by the way, would like to see them stay on the base for the 21 days after they're back.
And I understand their concern, but and again, this is the we think that it's prudent to have them checked twice a day on base, but be able to return to their loved ones in the evening.
Well, what we appreciate is your mission is and always has been to protect this country, and we appreciate your service.
Thank you.
I thank the gentleman. We now go to the gentlelady from New Mexico.